And I think we're just going to go ahead and get started. So, um, hi everyone. Thank you for joining us today for the second seminar of Youth Medical Society, also known as YMS. My name is Akash Murali, and I am the president of YMS. Also with me today are our officers, who you'll hear from a little later today. Now, YMS is focused on providing high school students with an interest in medicine, access to expert medical professionals. Our membership noted a particular interest in neurosurgery, and to that end, I am pleased to introduce you all to Dr. J. Nathan. Dr. Nathan is a clinical instructor in neurosurgery at Stanford. He completed undergraduate studies at the University of California, Berkeley, with a double major in economics and neurobiology with honors. Following medical school at Stanford, he completed neurosurgery residency training at the University of Michigan. During residency, Dr. Nathan utilized big data to study spine surgery, patient outcomes, including examining reductions in opioid use after various spine operations. He served as a U.S. Senate Health Policy Fellow in the office of Senator Bill Cassidy in 2018, researching and advising the senator on issues ranging from Medicare reform to telemedicine, prescription drug pricing, and medical devices. Now, we are honored to have you with us today, Dr. Nathan. Let's go ahead and jump right in. Dr. Nathan will provide some introductory remarks followed by a Q&A session. So, Dr. Nathan, thank you for making time to join us today. Can you please start by telling us a little bit about your childhood, where you grew up, and what experiences made you want to initially pursue a career in medicine?
Well, thanks, Akash, and good afternoon, everyone. Really excited to be able to spend some time with you and talk about your interests in medicine and neurosurgery, what that kind of entails. Along the way, for anyone who kind of advances in their career, they can't do that without really good mentorship and advice from folks who've gone before. So I like to, have the opportunity to then kind of pay that back. As I'm sure you all are going to do one day as you go on to great things. So I kind of was interested in science and medicine from a pretty young age, I would say. I always find science really interesting. Would enjoy learning about biology in particular. When I was in your shoes as a high school student, I had some great biology teachers. Took AP Bio in high school and just found it, really fascinating. Was really drawn to it at that point. But I also liked teaching and tutoring and kind of helping people in some way and kind of working directly with people. So medicine seemed like a nice way to be able to do both of those things simultaneously, still learn about biology, learn about the human body, and then be able to help people who are, struggling with issues related to that and get them back on their feet. So going into college, definitely knew I wanted to study biology as a major. Always found the nervous system particularly interesting. Just found it really amazing that it is what makes us human and what kind of separates us from other mammals, other animals, and just the incredible capacity that we all have. So that was really interesting to learn about. And I think Berkeley was a good place to do it, a strong biology program, and I had some great professors for that. Economics was something I kind of discovered more later in high school. When I was a senior, I took AP Econ. That was really my first introduction to it. And then going into Berkeley, there's a great econ department there. So figured out a way to be able to do the double major within 4 years, and figured if I didn't like it at some point, I could always change my mind. But as I took more econ classes, just kind of fell more in love with it, really enjoyed it. And actually, and we'll probably touch on this later on as we talk, but I found it really helped me understand science better in terms of a lot of the math that underlies economics, statistics, some of the analysis that happens. There's a direct connection in using those tools with scientific research too. So I think it helped me appreciate science all the more and kind of develop critical thinking, critical reasoning skills. And then basically took a year in between college and med school. As I was applying to med school, I was teaching for Kaplan at the time. And so that was a chance to kind of learn how to, teach to a classroom, do more tutoring, explain concepts. I was teaching MCAT prep classes at that point. Went to med school here at Stanford, had an extra year here doing research, doing neurosurgery research, and was interested in neurosurgery pretty much from the beginning. In part because I was always interested in neurobiology and figured that would be a great way to apply that. I'm more of a hands-on person. more impatient, I would say, and more interested in like the instant gratification you get when you do an operation and you can fix something and you can actually see the results of your surgery right then and there. And sometimes our patients get a benefit from that surgery right away. You know, they wake up and they're already feeling better, and that's really gratifying to see. So surgery kind of felt like a great avenue to take that neuroscience interest. So after med school, as Akash mentioned, went to University of Michigan for residency. Every residency for medical fields is different in length. At a minimum, they're 3 years after med school. So if you're doing something like internal medicine, which is what most doctors go on to do, it's a 3-year commitment after residency. Surgical fields take longer because in addition to learning the medical ways of taking care of patients, you have to learn about medications and how to manage patients in the hospital, how to get them safely home. But on top of that, you have to learn how to do surgery. You have to learn all the tools. You have to learn the different procedures. So there's a lot more involved with that. So surgery training at a minimum for like general surgery is 5 years. For neurosurgery, it's 7 years. And so that was a 7-year residency. Along with that, we have some research time built in. And so, you heard about a couple of the projects that I worked on, and that was really interesting to be able to take that interest and then do some research and try to advance the field in a couple of areas. So I just finished residency in June of this past year, and then moved back to California for fellowship at Stanford. Fellowship is where you do kind of extra specialized training in a field. So within neurosurgery, broadly, there's operations on the brain, and then there's operations on the spine. It turns out most of what neurosurgeons do is spine surgery, just because fortunately brain tumors, brain types of problems are way less common than spine problems. And I've found spine surgery really fascinating, and it was great to see patients doing really well from that. So I got interested in spine surgery. So I'm doing a 1-year fellowship here at Stanford. The kind of fancy term we use for that is clinical instructor, but that basically just means I'm done with residency, kind of ready to transition to practicing independently. So I'm looking for jobs right now as far as kind of long-term positions for neurosurgery. So that's just kind of the broad overview of, the past million years of training that I've had.
Okay. Thank you for a little bit of background on your own expertise. Now I'm going to invite some of the officers to pose some questions for you. Now, for the officers, can each of you guys please introduce your name and title and ask your question? So, Akarsh, let's start with you.
Hi, Dr. Nathan. Thank you for coming once again. My name is Akarsh, and I'm the website director. And my question is, can you share what made you choose to specialize in economics and neurobiology as an undergrad, and what ultimately made you decide to go into neurosurgery? And also, are there any experiences during medical school that stood out to you as key learning moments?
Yeah, thanks, Akash. Great question. So economics for me, I think I found really interesting in high school, learning more in depth about, why is in some ways our country and government set up the way that it is. A lot of that has to do with the economic history of our country. And then learning about current events in better detail. I would, as a kid, and I would say I've been a nerd my whole life, so that just kind of continues along. But as a kid, I would always follow the news and current events, and I was just kind of interested in what was going on. But I think until I started learning economics and taking an interest in that, I didn't really kind of get it. So I think it was nice, even as a high school student, to have a little bit better clarity on what is everyone talking about when they're talking about the budget that the government's putting together? What is a deficit? Why is that important? How does the stock market work? How do individuals make decisions? And economics, really, I should point out, is about more than just money. It's really about decision making and about incentives. And when I started taking more classes in college about it, that's when I really gained an appreciation for the breadth that economics covers. There's a big part of economics that studies healthcare economics. So I took a class on that in college, and then that's kind of dovetailed really nicely and paired nicely with my interests in medicine, because as you all know, healthcare in the United States is incredibly expensive. It's incredibly complicated. But we also lead the world in discovery and advancement. And, there's a lot of positives that come out of it too. So I think Studying economics was helpful so that I can get a better sense of what's going on in healthcare. How do you craft better policy? How, as a doctor, when you're seeing patients and you're actually doing medicine and you're living the healthcare system, how can you then take that information back to policymakers? So having that econ background's been super helpful for that. The neurobiology part, as I mentioned in studying biology in high school, I thought the nervous system was really the most fascinating part for me. And so that's kind of where I had that interest. At Berkeley, some of you may be familiar already with it, but there's basically two broad biology departments. There's molecular and cell biology, and there's integrative biology. I was within the MCB department, which tends to be a little bit more popular, especially among pre-med students. A lot of the pre-med students are MCB majors. MCB, at least when I was going through, had 5 different emphases that you could do. So a lot of people did cell and developmental biology, for example. So that's like pretty standard molecular and cellular biology. But if you wanted to do neurobiology, you could take additional classes. So I took like mammalian neuroanatomy, for example, or molecular neurobiology, where you learn more about medications and how they affect the brain and that sort of thing. So I thought those classes were just super interesting. And why, and therefore in med school, I was kind of continuing along that path. I think in med school, some of the most like defining teaching moments really were kind of learning how to interact with patients, and a lot of the clinical teaching that we do. It's interesting, in the first year of med school, pretty much everywhere, they now have these standardized patients who are like basically actors. Anyone from the community can just kind of do the training on how to become a standardized patient. And they kind of pretend to have a medical problem, or maybe they're just coming in for a routine visit. So they come in and you get a chance to like interact with someone who's not a real patient, but you practice the skills of how do you take a history, how do you do a physical exam. And I think those were, it was really great to have that kind of exposure before you're actually interacting with real patients who are scared and nervous. And, you want to make sure that you can put them at ease when you're talking to them.
Thank you.
Hi, Dr. Nathan. My name is Aryan. I'm the other website director. And my question for you is, has your career been exactly as you'd had expected it to be? Or have there been any surprises that has changed your perception of the field?
Hey, Aryan. Yeah, thanks. Yeah, definitely not entirely as expected. And I think my advice for all of you would be to keep an open mind, to be flexible, to not worry if things don't go exactly as according to plan, because that doesn't always mean that they're going worse. And you can never really anticipate how life will play out. You also, I think the hardest thing to understand and to appreciate from your stage is that your interests and the types of opportunities that are available to you are going to change in ways that you can't expect. And so to try to keep an open mind to that. I think for me, some of the differences and surprises, I guess, were when I was in undergrad and med school, I was doing research projects and kind of had interests outside that were more lab-based and more kind of, strict, like, as we would say, basic science, like doing experiments in a laboratory setting. And I think what I didn't do until maybe later in my training is figure out a way to like take my interests in economics and other social science type things and tie that into my medical practice or my medical research. And so I think what was surprising for me is then getting to residency and then figuring out how to make that work and find a field that or find research interests, find like other interests within neurosurgery that tied everything together. I think another surprise for me was that medicine, and neurosurgery, I mean, I think that there's like a kind of mystique about neurosurgery that like you have to be a genius or something to do neurosurgery. And that's just not the case. You have to be smart enough, obviously, to go through college and get good grades, and you have to do well in med school. So there's a certain baseline level of intelligence that's needed to do it, obviously. But it's not as much about that really as it is much about diligence and hard work and managing stress well and managing things under pressure. you'll find, as you get farther along in school and your training, that your time gets more and more limited. And so you can't do everything you want to do or everything that's asked of you. You have to like pick and choose. So I think I was kind of surprised by that in residency, about how much being a neurosurgeon, especially as a resident, when you're in the training phase, is just about hard work and planning and kind of sheer will, and not always about like thinking through the problem. A lot of medicine is actually getting something done. Like you have to be able to execute on a plan instead of just coming up with it. And I think that was surprising compared to like more of a research track.
So in addition to that, what does a typical day look like for you right now? Like, what do you enjoy the most, and what do you find the least enjoyable?
Yeah, so life is actually pretty good as a fellow right now, where I'm at. So, today, for example, we're in clinic. I'm coming to you right now from our clinic building. So clinic starts at like 9 a.m. and then we're usually done by like 5 or 5:30, and we have a break for lunch, which is good. It's a pretty kind of routine and scheduled portion of the day. We're usually in clinic for like 2 days out of the week, and then 2 to 3 days out of the week we're in the operating room. So that's how we kind of split up our time. Sometimes you might have a day that's split where like you're in clinic in the morning and then you're doing a case in the afternoon and an operation in the afternoon. But usually that's kind of how the week is divided. And I would say that kind of schedule is like what a typical neurosurgeon schedule looks like too. So someone who's finished their training is out in practice. In medicine, a lot of things in the hospital happen earlier in the morning, and there's a lot of reasons for that. But we typically start in the operating room at about 7:15, 7:30 in the morning, as far as getting the patient into the operating room. And then we have a lot of setup that we have to do before we actually start the operation. That's just to kind of give you a rough lay of the land. Residency is definitely the most grueling part of neurosurgery for most people, and the hours are much more demanding. So, on average, residents, when they're in their kind of main clinical years, are working about 80 hours a week. So we would come into the hospital around 5:30 in the morning, and then you would be there until however long it took to get the work done. So most days you were there until like maybe 6:30. But sometimes, we would be there even later than that doing operations. And then occasionally you'll be on call. So when you're a resident, you'll take call for usually 24 hours. Some places do it differently, but usually it's like a 24-hour stretch. In terms of what I find the most kind of enjoyable, I mean, I would say it's really the thing I like best is talking to patients, interacting with them, especially when you see them do well. And I think the most gratifying thing for me is, right after you've done an operation, if you already see a benefit. Patients sometimes wake up and they're amazed. The pain that they've been having for years is gone, or they feel like their strength is coming back. And then you see them back in the clinic after surgery, and they're just really grateful. It's hard to kind of top that, because you feel like, okay, I did that thing. I saw there was a problem there. I took care of it, and now that person who gets their quality of life back, and they get to do what they enjoy. I think maybe the less enjoyable parts are sometimes you do run into barriers along the way of taking care of that patient. So there can be delays for one reason or another. Sometimes just the logistics of getting things put together. Everything that happens in the hospital is a pretty large, complex place. And so sometimes you feel like you're having to move mountains to get the work done. So there could be those frustrations. But I think when you keep in mind the end goal, I think one of the coolest things in medicine is that it's a big team of people all working for one person. And then you actually get to see them improve, and that makes it all worthwhile.
Thank you.
Hi, Dr. Nathan. My name is RJ, and I'm the treasurer. And my question to you is, what have been the critical milestones in your career, and are there any things you want to achieve that you still want to achieve?
Thanks, Archith. Yeah, I hope there's still things I want to achieve. Otherwise, I should just retire. Sometimes I joke with people that like the training is so long that once I'm actually in practice, then I'll just retire, because I'll be like too old at that point. But yeah, I think the milestones, the main ones I think that everyone can look forward to are like just the kind of admissions, the acceptances you get as far as getting into college, getting into med school, residency, et cetera. I'd say it's medicine is kind of set up in such a way, if you choose to kind of go down that path, where on the front end is where a lot of the like selection and the weeding out comes in, where in college it depends on where you are, but some places are more competitive, and everyone around you is sort of competing for a limited number of spots. Once you get into med school and you're there in med school, you kind of feel like you've gone to the other side of that equation, where now like everyone's really supportive and they want you to become a doctor because they just accepted you into their med school. And there's like maybe 50 to 100 other people they could have picked instead of you, and they chose you, and you're there. So they want you to be successful, and they want you to be a good, safe doctor who's going to go on to do whatever it is that you want to do. Residency can be competitive too. It depends on what field you go into. It's just kind of a numbers game of, some fields have more spots than others. I'd say neurosurgery is kind of moderately competitive. Just to give you an idea, something like 85% of people who want to do neurosurgery find a residency spot. So there's only 15% who might have to wait a year, do something else, or they just decide to change career paths. So, there's some fields that are more competitive than that. But I think once you then get into residency, you're like, okay, like now definitely people want you to continue on. You feel like at that point, once you select your field, that you've become part of a family, that you're kind of chosen your identity a little bit more, that not, just being a doctor, but I'm this kind of doctor. I'm a surgeon, or I'm a medicine doctor, or radiologist, or whatever it is. So I think that's definitely a big milestone. And then finishing residency as well. Now it's definitely feels good to be on the other side of things because of just how busy it gets. I think in terms of some of the things that I'm looking forward to, board certification. So that's kind of where you get your final stamp of approval from the committees, from the people who oversee the field, to say that like you've had the right training and you're ready to practice and see patients on your own. And then definitely staying active with health policy. I really enjoyed the time that I got to spend in the Senate. And so just being able to continue to talk to policymakers about, like, these are my thoughts. This is what I see every day in taking care of patients. And this is the direction that the healthcare system should go, or these are the things that we have to fix. That's definitely something I want to keep working on.
All right, thank you.
Hi, my name is Tumin, and I'm one of the publicity directors, and I have a couple questions for you. So I'll just ask the first one, which is, how have you seen the field of neurosurgery change over the time you have been practicing?
Yeah, thanks, Tumin. Neurosurgery is a really exciting field because it's constantly getting better. It's constantly advancing. Some of that is because of lab research that gets done. I'm sure you all have kind of heard about some of the projects that are happening in neuroscience generally. And I think this is an amazing time for neuroscience because we've gotten such great advances in computer technology and AI, in large data sets, and the processing power to analyze a lot of the research that's happening. So some of the really cool things that happen in neurosurgery that are based on that is in a field called functional neurosurgery, which deals with the actual function of the brain and how do you modulate that. So there's something called deep brain stimulation. There's some pretty amazing videos. If you just go to YouTube and look for deep brain stimulation for Parkinson's disease, that's probably the main disease that it's been used for. But I've done some of these cases where someone with Parkinson's disease, or someone with a tremor that's not Parkinson's, but is another kind of case, we can actually do these surgeries with the patient awake. And I have to tell you, it's like one of the most dramatic things I've ever seen, because you have a patient who's awake in the operating room, you've drilled a hole in their skull, and you've placed an electrode into a deep area of their brain. And then you're stimulating that electrode, and you see their tremor just stop. And I've seen patients break down crying in the operating room because they've been dealing with this problem for years. And with just that electrode placed and a flip of a switch, it's gone. And it's just a really incredible thing to see. And so that's been awesome to see in some of the technologies that have happened in that area. I can tell you within spine surgery, there's three main areas which I find really fascinating. I think you guys would like hearing about. So the first is the use of image guidance, basically a GPS system in the operating room. So we can actually take a CAT scan of a patient when they're in the operating room, put that on a computer, and then when we use tools, if you guys have seen those clips of how they make video games, they have little gray balls on people and they're moving and they can capture the motion. Well, we use that exact same technology in the operating room. We have these little gray dots on our instruments and the computer tells us where we are. So now we can, even without exposing and looking at the entire spine, we can place screws into the spine, place instrumentation, and get to where we need to go really safely and with much smaller incisions for patients. So they get less pain, they're back on their feet faster, they're out of the hospital faster. And it's a really safe procedure because we're not guessing about where we're placing. We can actually see in three-dimensional space exactly where we are. So that's one area that's super cool, that even over the course of my residency, we went from like basically doing it maybe once or twice to almost every operation we do now, we use that kind of technology. And that's just in like 6 or 7 years that I've seen that transformation. The other area in neurosurgery that is going to just explode, and it's already really become very big, but it's only going to keep growing, is treating stroke. So most strokes that happen are because of blockage of a blood vessel going to the brain. And it used to be that we just said, oh, that's just so bad. We're so sad that your grandfather had a stroke. There's nothing we can do about it. And now if the patient comes in early enough, we actually have surgical procedures we can do where instead of a big incision, we go in through the blood vessels, use the blood vessels as a highway for a small wire that goes and grabs that clot and takes it out. So now you can actually restore blood flow to the brain in a procedure that literally takes like 20 minutes to do. And patients, I've seen patients who come in and they cannot move one side of their body. And within hours after this procedure, they have like normal strength again. You gave them their life back. You gave them, the use of half of their body back by this procedure. And it took very little time to do. So I think that's really fascinating. And then the final thing I'll mention is we're starting to use more robotic technology in neurosurgery, especially with spine surgery. So I think that's going to advance tremendously over the next 10 or 15 years.
And your second question is, what are the major breakthroughs in the field that you are looking forward to, and how would you like to see the field change in the coming years?
Yeah, so one of the things I'm really excited about, in addition to the robotics and image guidance piece, is there's a lot of research going on and development for augmented reality, or AR, in spine. So imagine that instead of looking at that computer monitor that I was mentioning when you're doing the surgery, you're wearing special goggles and you can actually just look at the patient, and then all of their anatomy is just like projected on top of that patient right in front of you. So you're able to just look in one place and you see all of it there. I think that's definitely going to happen in the next few years, and it's going to be super exciting. And then I think the other areas that are really interesting are more in the lines of functional neurosurgery, like I mentioned. A lot of research on stem cells, using stem cells after stroke. In fact, at Stanford, there's been some really good trials of seeing improvements in function after patients have gotten injections into an area of the brain that's damaged. There's also a lot of research looking at spinal cord injury and how do you improve the regeneration of those nerves. Some nerves can regenerate. The nerves that are in your arm or leg, for example, if they get damaged, they can actually grow back and they can repair themselves. But nerves that are in the brain or that are in the spinal cord generally can't. So there's a lot of really exciting work happening there. I think that would be a game changer, because then patients who actually have what's now considered a permanent injury, now we could actually do a procedure and potentially reverse that.
Thank you.
Hi, Dr. Nathan. My name is Ashley. I'm the other publicity director, and I have 2 questions for you. The first one is, what are your other interests outside of medicine?
Yeah, thanks, Ashley. So I have, over the last couple of years, I've gotten really interested in Formula One and car racing and like learning more about cars. So I really like that. There's a great Netflix documentary called Drive to Survive. I don't know if any of you guys have seen it, but if you haven't, you should definitely check it out. But it kind of talks about Formula One, and I just found that really interesting. The races are like most weekends, so it's easy to watch. And then I mentioned before that I took a year between college and med school, but one of the things I didn't mention is I got my pilot's license during that time. I loved flying since I was a little kid and had some additional time then to do the training that I needed to do. It actually doesn't take that long to learn and to get a pilot's license. So I haven't flown recently, but that's, I still like kind of thinking about flying, doing using a flight simulator on the computer, that kind of thing.
And my other question was, how do you balance out your life so that you can manage stress?
Yeah, that's a great question. I think there's no like one right answer or magic formula for it. I think what's really important and one of the best pieces of advice I could give to you guys is to find what really excites you and what you just kind of are naturally drawn to. And that when you're doing it doesn't really feel like work. It doesn't feel like it's tedious or that it's a chore to do it. And then if you can make that your job in some way or like make that your profession, then that kind of allows you to sort of do your hobby as your job. That's like kind of a nice way to set it up. So I think within medicine, I enjoy talking to patients. I enjoy teaching them about what's going on, explaining why they need a certain treatment or not, or like why we recommend something. So it doesn't feel as like onerous. It doesn't feel draining. But in terms of then getting out of that, I think it's really important to have some time each day to just kind of decompress, whether it's just like watching something on TV or reading for fun, having a sport, having something that you can do for physical exercise. One thing that also I think surprised me is just how physically demanding surgery can be. Sometimes we're standing for hours on end doing an operation, and you don't have a break. You're just standing in the operating room operating. You're there as long as you need to get the case done. And then by the end of it, you're like, wow, my neck really hurts because I was like bending down like this, or my legs are totally exhausted because I've been standing. So I try to at least do some kind of exercise to stay physically fit for that. And then taking vacations, and obviously it's harder to do right now, unfortunately, as far as taking trips. But I love to travel and get out and see the world and just learn about different people and different places. And so having some time set aside where you're like totally separated from where you normally are and people can't get a hold of you for emails and stuff like that, I think that's really important.
Thank you.
Hi, Dr. Nathan. My name is Rahul. I'm VP. My question to you is, what advice would you give to students like us who have an interest in medicine but are still trying to decide if we want to go to medical school?
Hey, Rahul. Yeah, that's a great question. I think where I was in your all's position, as far as being in high school, I was definitely thinking about medicine at that point. I was also, when I was in high school, really interested in law and speech and debate. I was in the speech and debate club for a couple years. Found that really interesting. Definitely argued with my parents a lot, so I had plenty of experience arguing and trying to get my point across. So I thought about other careers too, and like things outside of medicine, outside of science. And I think that's important. Like, I think it's really clarifying if you have interests in a bunch of different things to be able to figure out like why it is you want to do that one thing versus not do the others, or how can you maybe keep some of those interests and like mix that in with what you're doing. So my advice to you in terms of like being interested in medicine is I think it's a great field. I think that there's few jobs where you get that kind of personal satisfaction. Like when I go to work, there isn't a question of like, why am I doing this? Or like, what am I doing? Right. Like, I think certain jobs, if you're doing it, it's like, okay, yeah, you're doing these tasks and you're doing these things, but like, why? Like, why does it matter? Or who are you helping by doing that? But I think if you are kind of a person who gravitates towards, you want to see people happy and doing well, and you like serving other people, you like being able to take your skill set and help them. I think it's really hard to find another field that you get to do that day in and day out. And people trust you also. There's an inherent trust that's placed. There's an inherent gratitude that's placed. It's not to say that's true with everyone. I mean, there are patients who are difficult, and it's not always going to go perfectly smoothly, but for the most part, people are very happy. And I think and they're very appreciative of what you do. And I think the reason that's important is because when you're working, and no matter what you do, eventually it's going to get repetitive. Eventually you're going to become an expert in what you're doing, and it used to seem really new and exciting, and it's not going to be as new anymore. Hopefully it's exciting, but for me, I think the excitement comes from because you know why you're doing it, not just the actual process of doing the work, but you know what the end result is, and you know that that's important. So I think that's the kind of person that does well with medicine, and I think the kind of person that feels satisfied with it. I think going into medicine out of interests of money or career advancement, I don't think is actually that efficient to do, honestly, just because there's much easier ways to make money. So I would discourage that because it's a very long process of training, and it's a lot of hard work. Especially right now, you're used to being in the classroom and you study for a test, you do a homework assignment, you get rewarded for that. You get a grade, you get immediate feedback about what you're doing. The farther you get in your training process, the less of that kind of immediate satisfaction you're going to get, and the more that your training is going to change. So med school is kind of this, college is essentially like high school. There's not a whole lot that's different. It's just, there's more classes, more different things you can do, but it's the same kind of skill set. If you're good at studying and being a student in high school, you're going to do well in college. Med school, it starts to change a little bit from you're not just in the classroom anymore. It's not what you've been used to all these years. Now it's like interacting with people, and then it's working in a team and being in a hospital, which is totally different. So I think, and then as a resident and beyond, the skill set totally changes. So my advice right now would be to just focus on studying, focus on what excites you, try to figure out at your core, what do you like to do? And I think that will help you go a long way.
Thank you.
Okay. Thank you for asking and answering questions, officers and Dr. Nathan. We'll be opening the floor to members to ask questions now. And if you have any, go ahead and raise your hand in the Zoom call so I can let you know if you can answer or ask a question or not. Jackson?
So, hi. In what way would you say that your job has been affected by coronavirus and the whole COVID shelter in place type of thing?
Yeah. Hey, Jackson. Thanks for your question. That's, I think, a really good question. So I think with COVID, the real heroes in this from the medicine standpoint, from the doctor standpoint, are the ER doctors, the anesthesiologists, ICU doctors, internal medicine doctors, not so much surgeons, because it's really a medical disease, a pneumonia that people get, an inflammatory reaction that people get. And, the ER doctors and anesthesia doctors, especially, think about what they're doing. They're in a hospital and people are coming in and they don't know if they have COVID or not. They might be coming in for just any of the other reasons that, people are coming into the ER. The other diseases haven't ended. People are still having heart attacks. They're still getting blood clots. There's still all kinds of other stuff that's happening. They're getting into car accidents. So they're there and they're seeing everybody. And sometimes if it's an emergency, there's very little time to kind of sort out if that person has COVID or not. The anesthesiologists are placing breathing tubes. They're literally working in the highest risk place in the body for COVID. So I think we should all be really grateful, for the risk they take on. I think as surgeons, we're somewhat fortunate in that we're farther down the line in terms of when we get involved. Now, sometimes if there's a severe trauma as neurosurgeons, we see those patients right away. And I've been involved in a couple of those. But fortunately, we've had enough protective equipment. I haven't had a situation where I felt uncomfortable about that. When I was in Michigan and training, because I just graduated in June. And so the hardest months for us in Michigan prior to right now were March, April, May. And we actually stopped all of our scheduled cases. So any patient that we saw ahead of time and we booked for surgery, we completely stopped that, except if the person had cancer or if they had some condition that was rapidly getting worse where it just was too dangerous to delay. And then we were kind of available and on call for emergencies like traumas that came in. So it actually kind of ironically for us was less busy than normal. And we reduced the number of people that were in the hospital on our team so that we could try to reduce the risks for everybody and they weren't exposed to patients. We did have some patients who had COVID, but thankfully we were able to identify that early on. People took the right precautions. None of my, neither myself nor my teammates got COVID, which we were, I was what we call a chief resident at that point. So, we had 18 residents in our program and there's 3 of us who are chiefs, meaning we're kind of overseeing the residents, making their schedules, determining who's doing what operation. And so we felt a great sense of responsibility for their safety. And so we really tried to cut everything back, keep people out of the hospital as much as we could. We really had to change the way we did work because medicine is a face-to-face profession. There's a lot that comes from seeing a patient right in front of you. So in terms of us meeting as doctors, we did as much as we could over Zoom or over the phone rather than in person. That was a big change. There was a period of time where we thought we would have to create a field hospital like some places are having to do right now. And that if we had to do that and we didn't have enough personnel, that we would have to kind of step in. And instead of acting as surgeons, we'd have to act more as medicine doctors. Fortunately, it didn't come to that because we're not very good medicine doctors, but we would have had to figure it out. So at this point, I would say at Stanford, we feel pretty safe. Every patient that comes in for surgery is getting tested. I've gotten tested a few times. There's a surveillance program that we're doing. And so, I think things are under good control now, but as you know, the cases are rising and that could change over the next few weeks.
Okay. Any other question? Koshi?
Yeah, so I had a question as to what exactly you do currently. So do you teach students and are you working at a hospital or do you do them separately?
Yeah, thanks, Kushi. That's a great question. So at Stanford is a teaching hospital. So the way that we're set up is, we have the 2 days where we're in the clinic. And I would say on those days, I'm actually, if anything, more so learning rather than teaching because I'm learning a bit more about spine surgery, about making decisions about what diagnosis does the patient have, what's the best treatment for them. There's a lot of complexity involved in that, which I kind of like because then it's something that you do have to think about and you have to take a lot of things into account. When we're operating, those are either 2 to 3 days a week that I'm doing right now. That's a chance where I get to do a little bit more teaching. So Stanford has their own residents. So those are folks who they finish med school and now they're learning how to become a neurosurgeon. And so that's that 7-year process that I mentioned. So they're going through their residency. They're doing some of these operations along with me. And that's been pretty fun because I've gotten a chance to teach them and share some of the tricks that I've learned, And I think the neat thing with neurosurgery as a field is it's a pretty small field. There's only less than 7,000 neurosurgeons in the entire United States. And so we almost all know each other or are connected in some way. And so it's kind of nice to be able to bring some of the ways that I was taught to do procedures in Michigan and then kind of bring that to Stanford and see how they do things and mix and match. And then occasionally we have medical students who spend time with us. Unfortunately, with COVID, that's kind of been cut down some and changed. But when the medical students are there, I get to work with them too.
Okay. Any other questions? Akarsh?
So being high school students, sometimes it's really hard for us to get like experiences into the medical field, like shadowing opportunities or mentorships, for example. And it's become like infinitely harder because of COVID. So do you have any suggestions for how we can get involved in the medical field in any way possible?
Yeah, absolutely. So first, I would say not to stress out about it too much right now, to be honest with you. And the reason for that is that you can, if you're interested in medicine, you can always kind of have that in the back of your mind, and hopefully, by the time you're in college, COVID will be, subsided quite a bit, if not gone. And so then things can return to some sense of normalcy, and the usual opportunities will come back. That's definitely my hope for you guys, because I know this is it's a really tough time for all of you to be dealing with this. I think that the important thing right now is to focus more on the classwork that you have to do, get the best grades that you can, pursue whatever extracurriculars you can right now and that you're interested in. The reason I say that is because you're still a ways off from needing to make a final decision about medicine. And I think in terms of, then you might say, well, colleges want to see that you've done, X, Y, or Z extracurricular, or that if you're interested in medicine. But I think the thing is that you don't have to really even necessarily go into college with the idea that you're going to be a doctor or you're going into medicine. You don't have to have decided that. And I don't think college admissions places are going to even expect that of you. I think more so what they want to see is, I'll just put, kind of a side answer to your question, and then I'll get back to your question. But more so what college admission people want to see is that you're passionate about something and that you've done something to pursue that passion and that you've done well at it. And I think if you keep that in mind, you will wow people. You will really kind of make people say, okay, this is someone who's not just talking, because anyone can talk. Anyone can say like, oh, I think this is really interesting. But if you then actually convert that into action and you convert that into success, then they know that you're someone who can get stuff done and you're someone who has a commitment and you follow through with that commitment. And on top of that, and that's, again, it goes without saying, you've got a good GPA, good SAT scores, et cetera. But the secret piece of the extra piece of that puzzle, and I think where people get differentiated is how strongly they pursue that interest. And it doesn't matter what that interest is, right? Because there's accomplished athletes, there's accomplished musicians, there's accomplished researchers coming out of high school going into college. So it really, there isn't much bias that's placed. I'll give you an example of a friend of mine in high school. And I'm from San Diego. I didn't mention that, but I'm from San Diego. Went to a great public high school there. And frankly, felt like college was easy, compared to some of the high school classes that I had. So I felt like I was well prepared going in. But one of my friends in high school, she was a fantastic soccer player. She did, travel soccer and was really into it. She came to Stanford got a scholarship, played soccer, and then she was on the U.S. Olympic team. I mean, she was like the real deal, women's soccer player. And then I kind of lost touch with her for a couple of years. And then I next saw her in one of my MCAT prep classes that I was teaching in San Diego. And I was like, this is awesome because, she had found her passion. She did, and she pursued it to the highest level. But she knew she really was interested in medicine and wanted to do that. And so she did great. She got into a great med school and she's finishing her residency. So it doesn't really matter what that thing is right now as far as having that academic success. In terms of just trying to figure out if medicine is something that you want to do, I'll be honest with you and say that it's very, very hard to get that information, even as a college student. I think that the best way to do it probably would be to find volunteer opportunities in a hospital or clinic that, again, will hopefully come back after COVID. And being able to then talk to different kinds of doctors like we're doing now, find out, why did they get into this? What excited them about this? And can you see yourself like them? Can you see yourself in that kind of position? and just how does the environment of a hospital feel? How does the environment of like a clinic feel? And I think it's okay to do that in college. I don't think you have to do that in high school per se. The other thing I would say, just to kind of quickly wrap that up, is one thing I noticed is that, and there's a lot of reasons for this, just because you don't frankly know anything. I mean, even as a med student, you don't know anything as far as taking care of a patient. So there's not a whole lot that you can do for patients, but one avenue that people pursued was becoming a scribe. So there are these folks who actually, I've seen some folks who are in college and they do the training to become a scribe. And so what that actually is then taking notes for doctors when they're in visits with patients. So that's something to look into because you actually get paid for that. That's a job. And on top of that, you learn medical lingo and you get to work with a physician and get mentorship that way. So that is something to consider. But that didn't really exist when I was at your stage. It's a relatively new thing. But one thing I noticed was you could get a lot farther with what you could do if you did lab research. So that's an area where if you're interested in science and you're thinking about medicine, if you work in a lab, you can do whatever you want. There's no restriction just because you're a high school student or a college student. There's no law that says you can't do this experiment. It's just a question of what lab you're in and how you get trained and what you can do. So the barriers are way less on the research side compared to the actual like clinical side and seeing patients.
Okay, I think we have about enough time for 2 more questions. Let's start it off with Yasmin.
Okay, so my question is, does Grey's Anatomy accurately depict what is happening in actual hospitals right now? Like, is their use of personal protective equipment correct? And is their basic information correct and accurate as well?
So Yasmin, I have to admit, I haven't seen Grey's Anatomy, so I don't think I'm the best person to answer that question. I saw one episode of Grey's Anatomy. It was after a Super Bowl, and there was like a bomb inside a patient, and I was like, what is happening here? So no, I'm not like a Grey's Anatomy addict. I think by and large, it's not really accurate. It's pretty dramatic, from what I've heard. I think House, if you've seen the show House or heard about it, that's maybe a little closer. I mean, even that's not quite realistic, but at least in House, they're actual medical cases, certainly for the first couple seasons. And I watched House like a fair amount when I was applying to med school, just because I was in that kind of mood. So I would check that out. But yeah, don't expect life to be like Grey's Anatomy.
Thank you.
Yeah.
Okay, and someone asked me to ask you a question as well. And that question would be, can you ask if the procedures that you do are difficult and what your most difficult one is?
Yeah. So in neurosurgery, again, there's like a lot of mystique about neurosurgery. You have to have the steadiest hands and the strongest constitution and stuff to do it. So I think there's a lot of what we do that ends up being fairly routine after you've done it a few times. I mean, the first couple of times you are involved in surgery, you're like, what is going on? It feels like it's moving so fast and there's all these things going on around you and you're just like lost and you're just trying to stay out of the way. That's kind of like the med student level, you're like, oh, this is the operating room. I've never been here before. I hope I don't make a big mistake. But then as you do, like everything in life, as you do it more and more, you get more accustomed to it. So I'd say, some of the most complicated surgeries that I've been involved in have been tumors that are in the spinal cord. Sometimes there's tumors that actually grow inside the spinal cord. Those are incredibly delicate procedures because the spinal cord is it's so small and there's all those nerves running through it that it's not very tolerant of being touched and moved around. So in those moments, as you're doing like the key parts of those cases, everything just kind of stops and you're like holding your breath and, it's very, very careful. There's a couple situations like that in the brain as well, especially with brain aneurysms, which are small balloon outpouchings of a blood vessel that can burst. Sometimes, if we're fortunate, we can diagnose the aneurysm in a patient before it's ruptured, before it's caused a problem, and then we can place a small clip at the base of that aneurysm. That's a little bit like diffusing a bomb. I mean, it's like you're same kind of thing where as you're getting there and looking at the aneurysm and putting a clip on it, you kind of hold your breath that it doesn't rupture, and you could hurt the patient there. But I'd say in terms of what I do in spine surgery, a lot of it, you might be surprised to hear, is like not very technically hard. Again, you have to learn it. It takes some experience to do a certain number of cases to get comfortable with it. But to some extent, it's like a little bit like construction work or like being a mechanic in a way. You're fixing like a structural element, and we use a lot of similar principles. We're putting in screws, we're putting in rods, we're putting in instrumentation to kind of support the spine. So it actually ends up being pretty fun, as you get more comfortable with it.
Okay.
And I'm happy to stick around a couple extra minutes and take more questions if folks have them.
Okay. Yeah, if anyone else has a question, they can feel free to raise their hand. Yeah, or Luke Ponson. Luke?
Yeah, so what are the total education costs of becoming a trained neurosurgeon?
So it varies in terms of, if you're factoring in college. So if you're at a public university, obviously tuition is a lot less than some private universities. That was the case for me at Berkeley. Tuition was very reasonable. In med school, it varies quite a bit because some med schools, like Stanford, for example, has a lot of additional funding available. So when I took that extra year in med school, they actually had a grant that you can apply for that essentially covers the tuition that year. I would say a general rule of thumb as far as how much med school costs is probably around $250,000. So for like the whole thing, and that's factoring in tuition, housing, books, supplies, all that stuff. Now we're talking about that now, and you guys are 4 to 7 to 8 years away from med school, so that could even change and go up at that point, unfortunately. But there are some med schools like NYU, you may have heard, they're giving tuition for free. There's no charge for med school tuition. And I think there's other med schools who are looking at similar kind of model. There are also programs where if you want to work in an underserved area or practice a certain kind of medicine, they will forgive your loan or they'll give you extra payments back. And then residency, actually, once you finish med school, residency, now you're working. So you're actually paid. And interestingly enough, as a resident, your salary is paid by the federal government. So the Medicare program, which is the largest payer, largest health insurance program in the United States, and it's run by the federal government, they have a budget to support residency programs. So when you work for that hospital, the hospital gets money from the government. They don't pay you all of it because there's some cost with you being there, and it varies place to place. So if you stay in expensive areas like the Bay Area, you might be paid more than if you're in a less expensive area. But the nice thing is that now money's coming in instead of going out. So it's not very much money. It's just kind of enough to pay your expenses. Some people will use some of that if they can save it. They'll start paying off their loans, their student loans during that time. But most people wait until they're done with training, and then they're like an actual ready to go physician and they're seeing patients. And then to kind of compensate for the fact that the training is so long, generally the starting salaries for physicians are going to be higher than a starting salary for, let's say, an attorney or some other professional, just because you've been training all this time. So you kind of have to play catch up in terms of being able to save for retirement, that kind of thing.
Okay. Does anyone else have a question before we finish things off? Okay. Well, if that's the last question, I just wanted to thank everyone for joining today. Most importantly, thank you, Dr. Nathan, for making the time in your busy schedule to give us a glimpse into the life of a neurosurgeon. Our membership was particularly interested in your area of expertise, as I mentioned earlier, so we are honored to hear from you and benefit from your experience. Your career trajectory working in neurosurgery and on health policy shows us huge potential of opportunities in the medical field. And I know you have inspired many of us to learn more. I also wanted to express my appreciation for Mr. Chow, our advisor, who unfortunately isn't here today, who has helped us launch this club and is supporting us so much. That's it for now, everyone, and see you at the next club meeting.
Thanks so much, guys. This was a lot of fun. And I just put in the chat my email address. So feel free to reach out anytime if you have questions. Like I said, it takes a whole team, and I got a lot of help and advice along the way. So I'm happy to help out in any way I can. Best of luck, guys. Take care.
Thank you. Bye.
Thank you, Mr. Nathan.
Thank you.